many places in the world where people have little access to hygienic living conditions and basic health care. Cambodia is one of them. This lady is a typical example. Because she has had no access to common eye treatment, she suffers from cataract blindness, a condition that blinds great numbers of the people who live in the world's undeveloped countries. Typically, she relies on a grandchild to help her. This means that the child cannot go to school. It also means that she cannot contribute to the production of food and relies more heavily on her son, who has his own problems with living in poverty. In another country, Pakistan, the story is similar. The impact of being blind is devastating in her humble living conditions. Both of these women suffer from the same affliction, a preventable condition which has left them without sight and independence and the dignity of being able to look after themselves. Today their lives will change, thanks to a little miracle. Today they will be taken to an operating place, and thanks to the Fred Hollows Foundation in Australia, a specially trained eye doctor will perform a procedure developed through the foundation, using a lens provided by the foundation, using local infrastructure organised with the support of the foundation. Within a few hours of the operation, these people are able to see again and are discovering light and sight for the first time in years. As you can see, the experience of sight after such a long period of darkness is an overwhelming one, and most patients are somewhat numbed. But within days after the operation, each person is able to start work and participate in all facets of their community again. This is a little miracle that has been happening in over 35 countries over the past 10 years. In South Africa, in Vietnam, in Nepal, following the inspiration of the late Professor Fred Hollows, the Fred Hollows Foundation has assisted the restoration of sight to over 1 million people worldwide. Getting this done meant that the Fred Hollows Foundation has gone to places that people said it couldn't be done. Until a few years ago, the world's medical experts said that it was too difficult, too risky, and that it wouldn't be possible to do this kind of surgery in rural and remote impoverished communities. A key to choosing the places the foundation worked was that people wanted to help themselves, and the foundation's role was to help with training, microscopes, capacity building and the equipment needed to restore sight, such as a little intraocular lens. In Vietnam, the foundation helped train and equip over 230 local eye doctors. Nationally, there is now over 100,000 sight-restoring operations performed per year, with minimal financial input from the foundation. In other words, the power of people getting their sight back is so strong that money is found locally to pay for the surgery. In high population density areas such as Vietnam and Pakistan and Nepal, high-volume surgery has been achieved. But in places like Africa, the population density is lower and the health system is less well developed. Working in Africa presented a huge challenge to the foundation. A new comprehensive approach was needed. Tackling the seemingly impossible is a hallmark of the foundation's work.
I think every organization who's trying to do something there is viewed with admiration, and the outcome is going to be watched very carefully, because it's like it's an area where you don't succeed. It's an area where there's no possibility, and that's the sadness of it. And I think that's where you come in, where it's most needed. You want to make a difference, and that's what counts.
Every country has its challenges. In Cambodia, for example, there was only one eye doctor after the purge of the Khmer Rouge. Anyone wearing glasses was considered to be an intellectual and was murdered. So the foundation is working to support the development of eye care units in 3 rural provinces.
In Cambodia, the people in remote areas are very poor and afraid to come to hospital. The Fred Hollows Foundation has supported the training of health workers so that they can spread the information about cataract operation. Now they are starting to come to be operated on, and there are a great many people who are cataract blind. So we have a lot of work to do with your help.
In Pakistan's cities, eye doctors were reaching the wealthy and the middle class, but the poor and the vast numbers living in rural areas were not getting any services. So the Foundation has developed a large national program to help trained and equipped doctors and paramedical staff to bring sight-restoring surgery to every corner of Pakistan.
In less than 4 years, through a very strong partnership between Fred Hollows Foundation and the government of Pakistan, we have enabled the very poor and rural districts of Pakistan to look after their own eye patients. So far we have covered 12,000 cataract patients, but we have a huge backlog to cover. Of course, we cannot go ahead without your kind help.
Crucial to developing these programs is collaborative work with a wide range of government, local and international organizations. Strategic planning, budget forecasting, lobbying and advocacy are just some of the skills required by the Fred Hollows Foundation to maintain its highly successful work. Every minute of the day, someone is having their eyesight restored as a result of the Foundation's work. This is a major contribution. However, we are not resting on our laurels because there is much work to be done. Closer to home, eye health services in the Pacific region are sparse and inadequate. So the Foundation is playing an active role, helping to coordinate eye health activities in Papua New Guinea, Vanuatu, the Solomon Islands and recently Fiji. In Australia, the Foundation is working in partnership with Indigenous communities. It has adopted a flexible approach which responds to Indigenous priorities. This empowers communities to actively address the issues that they have identified. The approach is focused on working with people at their own pace, building on where communities are at, and seeks to develop innovative programs aimed at achieving long-term sustainable improvements in community health, development and well-being. The vision of the Fred Hollows Foundation is a world where nobody is needlessly blind. As we said before, 1 million people can now see thanks to the past work of the Foundation. We need your support to continue this great success. To make a donation or to get involved with the Foundation, please visit our website or call us. Please ring this number if you think that you'd like to help in some way.